I'm Dr. Modi. I specialize in infectious diseases. The flu vaccine is offered and recommended to virtually anyone who wants it. In particular, we strongly recommend it to people who are immunocompromised, who are older, who are healthcare workers, or who work in the general public on a regular basis, because those people are at high risk for coming across the flu. There is no upper age limit for who can get a flu vaccine, but depending upon which flu vaccine you're talking about, you can go as low as 6 months of age to get some of those vaccines. I would keep it really simple and make it a yearly habit to get the flu shot. It's just a good habit to be in. There's very little downside to the flu shot. We see very, very few reactions. So I would recommend to get the flu shot every year. So we've been making flu vaccines for many years now. And the way that vaccine is developed is by looking at what flu strains were circulating in the southern hemisphere, because their summers and winters are opposite of ours. So when we're experiencing our summers, they are experiencing their winters. And so they look to see what strains circulated in the southern hemisphere, and that 6 months is enough lead time to develop our flu vaccines. Each year, the flu vaccine actually has several strains in it to cover several possibilities, and that is changed every year. Although it is possible to get both the flu and the COVID vaccine at the same time, I personally wouldn't recommend it. And if you were to ask your primary care provider, they probably wouldn't recommend it either, partly because the COVID vaccine is associated with some symptoms in a significant number of people. And if you get both vaccines, you may increase the symptoms from both combined. In terms of safety and efficacy, it should be acceptable, and at some point down the road they may be given in a single shot, but currently they're given separate shots, and I would suggest that you may want to space them out by a week to 3 weeks. In summary, I would say that the flu vaccine has been around for many years. We've proven it's safe when given to large numbers of people. I expect this to be a mild flu season. And I think the single biggest reason to get the flu vaccine is just because it should be an annual routine. And it's just a good habit. And it does provide protection.